Welcome to the Transplanting Podcast. My name is Daphne, and with me today is, I almost said the lovely Bear. That's how you started, but Bear's with me.
Bear here. And today's guest is a friend of mine, Geof, who is a licensed mental health counselor, and he joins us from Longview, Washington. And I do personally know Geof, and he was so kind and was the first person to write me my first letter. And I am so excited to have you here with us.
I'm glad that it worked out for you. You just had your surgery, yeah?
Mm-hmm.
And it looks amazing.
Thanks.
How do you feel?
Thanks. I do feel a lot better.
Yeah.
I feel a lot better. There is a giant confidence that is, I feel like, that's it. I'm all resolved. I'm all good to go, and life goes on.
When you went in for your consult, did you tell the surgeon there's a couple of things you needed to get off your chest?
Yeah, that's exactly what I did. Yeah. And so with that, immediately, Geof, I want to just quickly ask, the difference between, licensed mental health counselor, how does that differ from a psychiatrist and a psychologist or just a regular therapist?
Well, licensed mental health counselor in Washington is equivalent to what you would call a licensed professional counselor in Oregon or anywhere else, and that's generally who you're talking about when you say a regular therapist. I do psychotherapy. I diagnose people. Sometimes I do some psychological testing. My degree is a Master's of Science in Psychology. I have all of the doctoral training up until dissertation, and then I ran out of money to keep going with that. So, you can call me almost doc, I guess. I don't know.
Almost doc.
Almost doc. But I got licensed at the master's level. To be a psychologist, you need a PhD or a PsyD in psychology with clinical training. And that allows you a couple of things. First of all, it allows you to do some more complicated assessments and testing and test interpretation and some of the forensic work as far as expert testimony and whatnot. A psychiatrist is a medical doctor who specializes in mental health disorders. And they sometimes do therapy, but a lot of the time they do an assessment, they write you a prescription, and they tell you go see a therapist.
So where do you fit in this again?
I'm the therapist.
I'm
the therapist. I'm the guy that you're going to sit on the couch and tell me all your problems, and we're going to sort through it together and piece it apart and, use some of the therapy techniques that we have to, try to make sense of your life and make meaningful change.
I want to ask, do you have one of the lounges in there? People can lay back.
Oh, a chaise lounge. No, that'd be nice. I do have a poster in my office of a unicorn laying in a chaise lounge like that, and the doctor is in a chair and he's saying, you really just need to believe in yourself.
I love that.
Yeah.
You really need to believe. That's like the jokes you were telling right before we started.
Well, I don't know if you've ever felt like a unicorn, but certainly me as a bisexual man, I was told, that I didn't exist, that there was, that wasn't real, or that if I was gay, I should just say I was gay, or whoops.
Totally called it.
There we go. Or if I was just trying to be trendy, I should stop at whatever. But it's like, no,
Yeah.
I can be a sofa bed.
A sofa bed.
A sofa bed, yeah. I might look like a sofa, but I can be a bed. And whether I'm in sofa form or bed form, I'm still a sofa bed.
Sofa bed.
Mm-hmm.
Okay, I was mishearing that. I was hearing sofa or self-a-bed. Like
Self-a-bed?
Yeah, like
yes.
Almost like the
like a
what do they say? Alphabet soup, whatever.
Yeah,
but you're the self-a-bed.
Self-a-bed.
You're everywhere under it.
Yeah, and so I kind of relate to the unicorn in that sense. Being told, you don't belong anywhere, you don't fit in, you don't really exist, and that sort of stuff. I'm sure you've never had an experience like that.
Oh, there's...
Never. I wasn't ready for the question.
Oh, you thought you were going to ask all the questions.
No.
And then you invited a therapist on.
No, it caught me off guard.
Mm-hmm.
I should be more ready for that. That's all right. Okay, so sofa bed. You're licensed clinical social. Is that what you said?
No, a licensed mental health counselor.
Licensed mental health counselor. What made you get into that?
Well, the simple answer is that when I was very young, someone helped me, and I thought I'd like to help other people like that too.
I like that.
Mm-hmm.
It's actually been an interesting thing that we've been seeing is that the people coming in, it was somebody's experience that changed them when they were younger that's been bringing them in.
Mm-hmm.
So that's, I don't know, it's something I didn't expect to see, but it's been kind of a recurring theme we've been seeing, and I've really enjoyed hearing that. So you brought a book here with you, the DSM-5.
Mm-hmm.
Can you explain what the DSM is? Because like you'll hear it in a lot of arguments about trans people. You know, they go, oh, well, they're in, you know, gender dysphoria is in the DSM-5, so clearly they are sick.
Well, I mean, we also have pica in the DSM-5, which
I've never
is
heard of pica.
pica is a condition where little kids put non-food items in their mouth, and it's really difficult to stop. Now, is the kid sick? Is there something wrong with the kid, or is that just a condition that some kids have?
I guess it depends on what the kid puts in their mouth.
That is
they
true.
might get sick.
Yeah, it could be a problem for them, but it's not it's not a disease in that sense.
Right.
Right.
So what is the DSM for then?
Well, the DSM, it's on their 5th edition now. It's the Diagnostic and Statistical Manual of Mental Disorders, and it is published by the American Psychiatric Association. There's a lot of research that goes into each edition of these. As a matter of fact, when this edition was published, they had some alternative diagnoses, particularly for some of the personality disorders and some different conceptualizations that they wanted to include, but the task force that was working on that hadn't their data compiled by the time the publisher was ready to publish. So they included it as an index, but we're still supposed to go off of the criteria in the front of the book.
Now, my understanding is there's already a DSM-6 out, but everybody hasn't caught up to it yet.
I think they're at the DSM-5 TR or text revision.
Okay.
At this point, which is what we were using before. This was the DSM-4 TR or text revision.
It's like with the software upgrades where they're like, this is 2 or upgrade 2, and then this is 2.1 and 2.2.
Mm-hmm. Yeah.
Okay.
So one big change that happened between the DSM-4 and the DSM-5 is that they renamed this condition. It used to be called gender identity disorder. Now, and you can hear in that there's already some pathologizing going on there with the word disorder.
Right.
Okay. So they removed that and they put simply gender dysphoria, which is a bit more descriptive of what is happening with the person. And the definition in here is it's 3 parts, just like with all of our definitions. Well, this is 2 parts. There's an A criterion and a B criterion. And the A criterion says it's a marked incongruence between one's experienced or expressed gender and assigned gender of at least 6 months duration as manifested by at least 2 of the following, : and we've got 6 bullet points here, right? 1, a marked incongruence between one's experience, expressed gender, and primary and or secondary sex characteristics.
Okay, sorry, you were on...
So basically,
Part
it's a marked incongruence between one's experienced or expressed gender and the gender assigned at birth. First is a marked difference between that experienced or expressed gender and the primary and or secondary sex characteristics, right? Primary sex characteristics are things like what your genitals look like and how your reproductive system operates.
Okay.
Secondary sex characteristics are things like muscle density, facial hair or lack thereof, things like that. 2, a strong desire to be rid of one's primary and or secondary sex characteristics because of a marked incongruence with one's experienced or expressed gender. And number 3, a strong desire for the primary and or secondary characteristics of the other gender. We got a little problem here too, because this language, the other gender kind of speaks to the binary.
Okay.
Right? So it's
Right.
you have to want to be the other thing. It gets better in the next criterion here. They say a strong desire to be treated as the other gender, and in parentheses, or some alternative gender different from one's assigned gender. So there they went ahead and they used some inclusive language to try to grasp the nuance of people experiencing gender outside of the binary.
Okay.
And then 6, a strong conviction that one has the typical feelings and reactions of the other gender or some alternative gender different from one's assigned gender. And then B, so that was all under A, right? You have to have at least two of those. And then B is the condition is associated with clinically significant distress or impairment in social, occupational, or other important areas of functioning. And now that's the criterion that is in all of the conditions that are listed in this book. It's not just that you feel that way, it's that it's causing you trouble in one of your important areas of functioning. And
Can you give just like an example of that?
Okay, so for example, I work with a young man who is having a difficult time going to public school and prefers doing school online because of the social dysphoria that he experiences when he's around other people. He hasn't started testosterone yet, and so he still appears very female and is often treated as such and misgendered. And so that would be a social functioning impairment.
Okay.
But also, since since it's easier for him to do his education in that setting, he's also missing out on the very important social needs that every human being has, and he expresses difficulty with that as well.
Right.
So it's a little bit of a two-edged sword there.
So when you're reading those, the question that popped in my mind was, it sounded like a lot of the dysphoria comes around feeling different from the sex either assigned at birth or whatever your sex is, right?
Mm-hmm.
But then that brings into question for me intersex people. Like, can you have dysphoria if you're intersex? Because it feels like that's like a mix of a lot of things in there.
As a matter of fact, we see instances of gender dysphoria have an increased rate among people with differences of sexual development, such as Swyer syndrome or Klinefelter syndrome or some other difference in sexual development. Complete androgen insensitivity, XX female, etc. Or XX male.
XX male.
Mm-hmm.
That, oh my goodness, now I'm the one
Now you
causing all
did
the
it.
bangs. Okay, so you said there's a new one that's coming out, you believe, or is already out, the 5TR?
Yeah, and I don't have a copy of that handy, but it's probably, if I would guess that it's probably available somewhere online for free.
My understanding is that a lot of the manual, so I was an electrician for a while, and you can find all of the manuals and code. You can find all of it free online, but you really have to dig through stuff to find it. They hide it pretty good because they want you to buy the book.
I think it's right on the American Psychiatric Association's website.
They're not trying to hide it. That's good. So what about a trans person then, right? Can you be trans and not experience dysphoria?
That's the trick here, right? Because there were the two criteria. The A criteria, you have to have that marked incongruence. And then the B criteria, it's got to cause you trouble in one of your important areas of functioning.
In just one area?
But what if you know that you're trans, you have a marked incongruence between your birth assigned sex and how you feel about your gender or how you express your gender, but you get up and go to work every day and you have friends and you can take courses and get good grades and whatnot? Well, we really don't meet that second criteria in that case. And so then you have a trans person who doesn't meet the criteria for gender dysphoria. But the other thing is, too, is that our definition of gender dysphoria here is meant to paint with a kind of a broad stroke because there are different types of dysphoria. Some people are very dysphoric about the appearance of their bodies, and that's their primary concern. However, we find that most trans people who undergo transition, once they've got hormones and top surgery and basically are being perceived the way that they want to, that's about as much as they need. Only in cases where people have extreme genital dysphoria do we then, go ahead and recommend the genital reassignment surgeries.
So they're not just handing those out like candy.
No.
I remember like when I first was coming out, I got a letter from my dad, and he asked me, he says, "So have you had the surgery yet?" And I'm like, you don't just go down to the corner store and they have somebody there ready to nip it off,
No, yeah. What was the process? How long did your process take from coming out to getting hormones to where you are now?
I started hormones, I think 2.5 years ago, and then I refused to come out. There's going to be some like internalized transphobia here, right? From just the way I was raised. But it was I think 6 months before I came out, because I didn't want to come out unless I could pass. Well, air quotes pass, right? I was very much in a I don't want to come out, and the feeling at the time, it's not a great feeling, but the feeling at the time was I didn't want to feel like a freak. Right? And that was how it was. Like, I recognize everybody's beautiful and has their beauty everywhere, and it's not so much about people being a freak. But at the time, that was the space I was in.
Sure.
And so I didn't want to come out until then. So it was 6 months, and then me and my ex separated at that point. I moved back up to Idaho where my job was. I'm originally from Arizona. So I moved back up to Idaho where my job was, and everything fell apart from there. But I've just kind of been out since then. I don't know. I think that's about all there is.
What did you have to do to get hormones?
Okay, so I think it was about 6 months of therapy before I started hormones. Part of it was like, so I grew up in a very Mormon community. I grew up in that environment. I went on a mission for that church. I even got to the point I was, as an electrician, I was building temples for them, right? And so I had recognized there were signs of me being trans, whatever, all the way back to a kid, right?
We call that trans hindsight.
Yeah, fair enough. Fair enough. That makes sense. So the signs really started sticking out to me around 12 is when I really started to notice. I was 20 before I put it all together and said, "Oh, I know what's happening now," And considering the community I grew up in, there wasn't any information about this, and I couldn't have figured, So it took a while for me to understand what was going on. But then, being in that culture also, I pushed it down for a really long time. It just, I'm sinning. I don't want to be that, So you're always praying for like forgiveness for being this awful being. And there was a purpose to this.
Well, so you asked, they're not just handing these out like candy,
right?
And so I just wanted to relate to your own experience, and so that you could tell us, you don't just go down to the corner store and
right.
And
that's what it was.
Get your stuff,
I was working on a temple in Detroit, and there was a store there that I had known about 10 years before when I had decided to push everything down. And I had forgotten about the store and everything, but it was very much a trans positive store, and they specifically specified in people cross-dressing and helping them feel affirmed in that kind of space, right? And I was driving down the road, and I saw this store, and I promised my younger self, I was like, "Hey, if you ever come across this place, we're going in there." And then I forgot about it, right? But I'm driving down the road, and I go, oh, shit, there it is. It's right there. So I went in, and that was the mistake, right? It brought all the feelings back up. And
then the egg cracked.
Yeah, it did. And someone told me at that point, they're like, "You realize you're trans, right?" I go, "No, I'm not trans." And they go, so I went and looked it up, and I go, "Oh, that is me." That's exactly what I'm going through.
Why are these memes so oddly relatable?
Exactly, right? And so I went in, I said, "You know what? I think I need to see a therapist. Let's try to find a balance in all these things." And the more I went through the therapy, I understood more of what was happening with me. And as I understood that, then I go, you know what? I think I want to go on hormones.
And who said that you should go on hormones, you or your therapist?
Oh, good point. My therapist said it was up to me. And actually, in a lot of ways, she pushed against me, saying, I want you to be absolutely sure before you go on to something like this. And then after that happened, I went to go see the place providing the hormones, and they didn't just hand them out either. It was you had to prove to them that you were in that space before they would even give it to you.
Yeah. It used to be that you needed 2 letters for hormones. Now, as an adult, you don't need a letter for hormones.
Right.
But as a youth, you do, but you only need 1. So, I mean, that's something that, at least in Washington, I don't know what it is in Oregon. But so that's something that has changed. You know, in the last 30 years, I think we've taken maybe 4 steps forward, and then the last 10, we've taken a couple steps back. Because it's different than it was in, say, the 80s when people were transitioning and they wanted to change their birth certificate. There was this medicalist sort of attitude in the laws where, well, if you've got the bits of this, then you can't be called that. So they wouldn't change your birth certificate unless you had bottom surgery.
Arizona still does that.
Yeah, which basically amounts to forced sterilization just for wanting to be who you are.
That's interesting.
Yeah.
Well, and it defines here's the end of the process.
Yeah. And thank goodness, I had the opportunity recently to speak with a wonderful man named Jameson Green who transitioned in the 80s. He wrote a book called Becoming a Visible Man. Check it out sometime. But he worked with the World Professional Association for Transgender Health, the WPATH, which writes the standards that I have to follow in my practice.
Right.
And got them to issue a statement saying that nobody should be forced to undergo any surgery in order for their identity to be valid.
That is really nice, actually.
Yeah.
That's pretty incredible.
Yeah. And so now, you know, except say for backwards places like Arizona, you don't even have to be on hormones. You can just be
Backwards places like Arizona.
Yeah. Well, but I just wanted to get back to my previous point is that when we talk about dysphoria, there's all kinds of different dysphoria. People have vocal dysphoria. For trans men, they're very lucky because usually that's fixed with testosterone. For trans women, you need training. Unless, you know, the few people who have been able to get on hormone blockers when they're young,
right,
and then get on estrogen in their teens and then go through the puberty that they wanted to go through in the first place, very good results on voice for those folks. But if it's someone like you who didn't realize that your egg was cracking until you're 21, 22 years old.
Right.
I mean, now we talk about training.
Well,
training.
and then growing up, I was always trying to sing bass because that's the more man thing to do. You have to be the man, and so you're trying to get your voice to go lower. And now it's trying to reverse that is really hard to do. You had mentioned about getting on blockers when you're, or unless you got on blockers as a teen, right? So one of the, I don't want to say misconceptions, I'll leave that up to you, but one of the things you hear a lot about is we shouldn't be giving kids hormones at all or offering them any kind of blockers because it's stopping what they should normally be going through.
Well, I mean, I just wonder where these people's arguments were for that in the last 7 or 8 decades that we've been successfully using puberty blockers to treat precocious puberty.
Wait,
Precocious puberty.
What's that?
Well, so precocious is early.
Okay.
So somebody starts going through puberty at 8 years old, and we're like, let's hold off on that. You give them the puberty blockers, and you wait until they're like middle schoolish, and then you take them off, and then they continue.
I didn't know that was a thing.
That's where we got those drugs from.
I'm blown away right now. I did not see that coming. That's a really good argument. Is everybody's journey similar to mine, where they're recognizing things as a kid, and it's like this linear process that there's all these signs building up to it, you put it together, and start on the process?
Everybody's process is a bit different. We talk about a couple of things. We talk about coming out, and we talk about hatching. The hatching and the whole egg thing, that comes from an interview that Ricky Martin had with, I think, Barbara Walters back in the 90s.
Okay.
Where she kind of pushed him on the rumors of his sexuality. And his response to her was something akin to, if you break an egg from the outside, you get death. But when an egg breaks from the inside, life comes out.
Oh my gosh.
Yeah, it's a beautiful analogy.
That is a beautiful analogy.
And now, when we talk about somebody who's probably trans but hasn't realized it yet, we kind of refer to them as an egg in that way. And
now I'm picturing like mama dragons and all that.
Great.
Yeah.
That's great. Some people have severe social dysphoria, right? And I think that's where most of, if you don't have bodily dysphoria, you most likely are going to experience some social dysphoria at some point, and that is, being perceived and treated in a way that is coterminous with a gender that you just aren't on the inside. And so, they tried to paint with very broad strokes so we could capture as much as possible here, but there are still experiences that people have that don't exactly fit into the definition we have. Now, here's a little inside trade secret.
Yeah.
No insurance company bills or pays when I use DSM-5 codes in my billing. I have to use ICD-10 codes. ICD is the International Classification of Diseases. And in ICD-10, there is no gender dysphoria. There is transsexualism.
Well, I'm not a fan of that.
I know, it's an outdated term.
Yeah.
But, if you're being seen for, gender-related stuff and they're billing for you, that's the code they're using.
This is interesting because I was in IOP program a year ago, and the psychiatrist would come in every Tuesday or whatever, and he would say, "Hey, here I am. You've got me for an hour. Everybody can ask me whatever you want," because he's like, "Well, you can, right?" And he just says, "Now's your time. Ask me whatever questions you have, and how often do you get that chance?" And so I asked him about gender dysphoria in the DSM-5, and his response was the reason gender dysphoria was even put in the DSM manual was because they needed a way to be able to treat these people and have insurance cover it. And so it was just purely added, if nothing else, because they're not considering it a mental illness, right? But
Right.
It was added to make it so you can bill through the
It's a condition, right? So and if I'm going to charge your insurance for something that I'm doing, I have to tell them that I'm treating something, right? And so we have some diagnoses in here which are fairly parsimonious, stuff like adjustment disorder with anxiety. Well, what that means is that something changed in your life and you're adjusting to it and you're nervous. Okay, but I can bill on that and say this is what I'm treating them for.
But are you billing on the DSM-5 or on the
No,
IS?
again, it's the ICD-10. Now, a lot of our diagnoses do match up with ICD-10. This one in particular doesn't. The reason why insurance companies are using it is because that's standard worldwide, whereas the DSM-5 is really just an American thing.
Okay.
Yeah.
I was not aware they don't. Well, because
it's the American Psychiatric Association.
Even if you're not dealing with hormones and talking about surgery, and maybe you just want general therapy for affirming care, do you still have to use the ICD-9 or the ICD-10?
Yeah, but I may not include your gender dysphoria diagnosis if that's not what you're seeing me for, right?
Okay.
But my practice with you is still going to be affirming. You're going to come in and I'm going to say, "How you doing today, sir?" And I'm going to call you by your name and refer to you that way when I talk to other people, and validate your experiences as a queer person, trans person, etc.
if I hear stories about people not realizing that they were trans until later in life, right? They grew up male, let's say, or in a male societal role, right? They grew up that way, made it all the way through even their careers, and then they're 70 years old and realize, oh, hey, I'm trans. Is that something that you can become trans? Or is it you're born that way?
That's an interesting question. The zeitgeist in the science is that it's something inherent to you, right? So, every trans adult was once a trans kid, is what we say. They just didn't know it or didn't have the language for it. And it's, given the influence that our socialization has on us in our culture, it's not surprising that people can be suppressing that part of themselves for so long and be in so denial of it. Or just be so sheltered that they don't even consider that that's an idea, right? Until they start to learn and see things. And so I think what we're seeing with some of the older folks who are coming out is they are being shown examples in society of people living their full lives in ways that make them happy and wonderful, and going, I didn't know that was an option for me, right? And so it can be kind of an awakening in that sense. But speaking of older people, we were talking about differences of sexual development earlier, and a funny little story is that there was a case of a 72-year-old man who was a father of 4, who went in. I think they thought it was a hernia, right? So they go in to operate on the hernia. They find out that inside he has a fully formed uterus and ovaries that has cancer, so they take it out.
I read about that a couple months ago. I'm trying to remember what it was that brought it up. There was something important that brought it up. I don't remember.
Yeah.
That's interesting. Someone comes to speak with you about gender. It's the first time they've even thought about bringing it up. How do you approach that?
I very much let the patient lead me. I ask them what their experience is. I ask them about their journey, what kind of messages, what are the first messages you remember about gender, if at all? What's telling you that something's different about yours, and that kind of thing. And that conversation leads them to explore. But the truth of it is, most of the time, by the time somebody gets to my couch, they've already done that work, and they're like, "Okay, therapist, I'm here for my gender-affirming care."
Well, so then that makes me another thing that we hear all the time, because there's so much misinformation flying around. But another one of the things we hear all the time is it's the fad thing to be. It's hip or whatever you want to say. Oh my gosh, I just aged myself, I think. But it's the
That's
thing
okay,
to be. It's
Kat, don't worry about it.
I love that so much. It's the thing to be, though. Everybody's being trans right now. So is it a societal thing like that people just come in and they do it because their peers are all coming out as trans?
Well, so what you're talking about is often referred to as the social contagion model.
Okay.
Being as, well, everybody's doing it, so it's a hip thing to do, I want to do it. We don't find that when we actually look at the evidence. Do we see a higher number of people coming out as trans in the last 10 and 20 years? Yes. Why do we see that? We see that because they are seeing examples in society of people coming out, being accepted, living their full lives, and understanding that that's a possibility for them. Have you ever heard about the left-handed graph?
No, but now I want to know.
Okay, so I don't remember what time period it is, so we'll just make up dates like 19...
That is quite the date.
That's quite the date. Left-handedness was punished. It was thought to be wicked. It was thought to be a sin. If you were writing with your left hand, they corrected you. They put it in your right hand. And then, observational scientists kind of said, it looks like some people are just kind of born left-handed. And so then we stopped. And we stopped correcting people on using their left hand.
Right.
And then so you saw this instance of left-handedness rise through society, but then it levels off again. So it's this little S shape. We stop punishing it, and then whoop. And so it appears that there's a kind of a threshold of percentage of people who are just left-handed. And when you don't punish them for being left-handed, more of them are going to express left-handedness. That's what we think we're seeing with LGBTQ people.
Yeah. That's really interesting. I just figured it was happening because more people were knowing about it. It was just kind of like autism going up, right? As the more information is there.
We're better at diagnosing it, yeah. And we're better at recognizing the wide range of presentations that there are in autism, and with the trans umbrella, right? We've got people who are non-binary, who sort of exist between the binary. We have got people who just they're outside of it completely. We have people who are gender fluid or gender queer.
Right.
And
can you explain what those are?
Well, okay, so gender queer is sort of a blanket term that means I am gender nonconforming and I don't fit into the box that you gave me, right? And I don't owe you any particular presentation, right?
I just am who I am.
I just am who I am, right? Gender fluid is somebody who maybe exists in the binary, between the binary in a sense where some days they're feeling more masculine, some days they're feeling more feminine, and their expression will change.
Yeah.
You know, people like Ruby Rose, for example, are a great example of a gender fluid individual.
Okay. Let's back it up. Before we had talked about the person comes into the practice, whatever, it's their first time starting to come out. What kind of mental health challenges are you seeing as they come out?
Well, there's fear, anxiety. There's internalized transphobia, which expresses itself as shame.
Right.
There's it's an interesting place to be. I mean, I take you back to that when you were in that thrift shop, and they were like, you know, you're trans, right? And you're like, no. And you look it up and you go, oh, wait a minute. Whatever you were feeling in that moment, it's like, oh shit, this is a real thing,
right?
And this is about me, and what am I going to do about it now going forward? So
that's a scary place to be.
It is, yeah. So, you know, I help people, you know, learn to regulate their emotions and to think critically about what's going on in their thoughts and in their hearts. Yeah. And then I advocate for them and help connect them with resources.
Okay. You mentioned anxiety and maybe some depression. Are they depressed because they're trans? They're doing something they're not supposed to be doing? That's where the depression comes from?
No, I think the depression and the anxiety most likely come from their living in a way that is inauthentic, right? And something we call minority stress or minority stigma. It plays into that too, because there are societal pressures. I mean, if you're, I don't have to have you imagine this, but imagine, if you will, that, you know, every time you turn on the TV, you hear some numbnut talking about how, you know, the parents who let you transition should be taken out and shot in the back of the head or some stuff like that. I mean, that's got to weigh on you after a while.
I mean, yeah, I heard,
Sure.
I don't know, 2008, they were having the big push about legalizing gay marriage. I heard so many people at the time, we should go take all the gay people, put them on an island and blow the island up, you know? Mm-hmm. So, I mean, it's a lot, very similar to the...
They're the same arguments. In fact, if you have a chance, you know, listen to some of Jamie Raines on YouTube. He goes by Jammy Dodger. He's a trans man from England.
Totally from England.
Yeah, totally from England.
If it's Jammy Dodgers, they're definitely from England.
But he makes the point over and over again. These arguments were the same when we were talking about letting women have credit cards. These arguments were the same when we were talking about civil unions between same-sex couples. These arguments were the same, you know, and they're talking, you know, if we allow gay marriage, then people are going to want to marry their sheeps or their dogs or stuff. That's sort of slippery slope fallacy. Well, now we've heard that recently with, you know, Kaya Rychek and the libs of TikTok making all these weird claims about litter boxes in schools because kids identify as cats and stuff like that.
Are they really putting litter boxes in schools?
No.
And who's scooping that?
Yeah, right? I mean,
No.
Take your own shit out.
Yeah.
they get the litter maids, robot ones.
The litter Roombas.
They climb in a little box and it spins around. Can you talk a little bit about the importance of pronouns?
Yes. Pronouns are a part of speech, and we use them every day. I just used one now. I said we. And then I said I. So there's another one. You can't get away from them. We have gendered pronouns to indicate that we recognize the gender expression of another individual. Sir, ma'am, he, her, they, them. These are important because they let an individual know that you're speaking to them or about them, right? Honorifics, sir and ma'am, I don't see what if I say thank you or if I say thank you, sir, what did that add? I still express gratitude. But if I'm gonna speak about somebody, I'm gonna I'm not gonna say their name. Well, I mean, the safest thing to do would be to say somebody's name every time you refer to them. You'll never get it wrong that way.
Yeah.
But we have nouns which are antecedents and pronouns, and you attach your pronoun to the closest antecedent that came before it, and there you go. So if I'm talking about somebody and I'm referring to them or their stuff, I'm going to use a pronoun that matches the gender that they are expressing. And if I'm not sure what gender that person is expressing, I will probably just use their name or maybe just ask them, hey, what pronouns do you like?
Fair enough.
Mm-hmm.
I mean, and it just shows a little bit of respect toward humanity by asking them that, because
Mm-hmm.
I think the purpose of the sir and ma'am at the time was an antiquated version of respect.
Mm-hmm.
And so I think this is just an updated version to ask them what pronouns they would prefer to be used.
Mm-hmm.
Can we talk a little more about the social side of things and what kind of challenges you're seeing trans people go through with societal affirmation? Like, what are you seeing as challenges when a trans person doesn't have that social support?
So when a trans person is in an unaffirming environment, so you get a kid whose parents are politically conservative and maybe religiously conservative as well, and they refuse to recognize the kid's identity. The chances of that kid developing depression, anxiety, other mental disorders go up, and suicide. Having just one affirming adult in a trans youth's life can reduce their suicide risk by 50%.
That's a better stat than I had.
Yeah.
That's heavy. There's, it's amazing that one person can make that different,
Mm-hmm.
that big of a
It
difference.
has to be an
person.
important person. It's
Right. Someone that matters
like
to the kid.
One of your parents, somebody like that. I mean, school counselor can help, but it's much better to have some affirming in your own environment.
Right. Well, then the question that's popping into my mind is about, you see in schools that they're upset that teachers are being affirming to kids and the parents don't know about it. I mean, is it the parents' right to get to know all of this information?
I think if the child felt safe telling the parents what was going on, the parents would know. And the fact that they don't should give the parents pause to think, why have I made my child feel unsafe to share this with me?
I really like that question.
I do too.
I really like that question. How do you find a difference between the mental health conditions that are related to gender dysphoria versus not related?
Because easy. When the person undergoes the treatment for gender dysphoria, which is transition, those that aren't related to the dysphoria stay, and those that were go away.
I mean, it makes sense. At its core, it makes sense.
Yeah.
But then it feels like, it almost feels like the doctor just throwing meds out to see what sticks, doesn't it?
Well, no. I mean, so again, we go back to that WPATH standards of care, and there's a little bit of gatekeeping in the medical community,
Right.
and therapists like me are kind of like at the front of that gate.
I mean, cis women can have top surgery, but then a trans man can't.
Well, that's not the kind of gatekeeping I'm talking about here.
No.
I'm talking about ensuring that I'm following the standards and that what we're doing for you is the right path for you. So,
Okay.
for example, we want to know before we put you on hormones that are going to make permanent changes to your body that this isn't some temporary thing that's happening because you're in a manic episode or you're having a psychotic delusion or something like that. And so the WPATH standards of care say that when I write my recommendation, I have to put down everything that I think you meet criteria for, and I have to be able to say that it is managed either by medication, therapy, or a combination of both.
I know for like bottom surgery, you have to have a year's worth of therapy behind it to show that it's not just a quick thing that, they popped in, got a letter, and ran out.
Mm-hmm. That can also depend on the person's history. I mean, if I've got a trans person who's been running around almost fully transitioned for 5 years in their life, and they come and say, I think it's time I want to take care of downstairs. I mean, they don't have to see me for a year, right? They've already been living a life for 5 years, and now they know what their next step is. And I can speak to that in when I take their history and I give a little psychosocial history in my recommendation.
Is people getting lower surgery required to satisfy being trans?
No. Mm-mm. You don't have to have any medical interventions at all to be trans.
Just social can be enough.
Yeah, you can just say, I'm a dude. Got tits, but I'm a dude. And truth be told, because gender is not. Sex, biological sex, if we want to throw that term around, isn't actually binary in and of itself. It's bimodal, right?
What do you mean?
So people with an XY chromosome are going to tend to develop.
I moved it out of the way.
Are going to tend to develop, penis and testes and facial hair and muscle density and whatnot. And people with an XX chromosome set are going to tend to develop, vulvas and uteruses and breasts and all of that stuff. But those are, averages. Those are bell curves, and they kind of cross over. There's a condition called gynomastia, which means female breast, but it is when men develop female breast tissue.
They're always the ones swimming without a shirt on.
There are conditions of macrocliteri as well, where a cis woman without any other interventions has grown a rather large clitoris that resembles a phallus.
Right.
There are cis women with very pronounced Adam's apples. And then there are cis men, like me, who don't have one, right? So all of these things that we think of that sort of separate us into these categories of male and female, they don't exist in that binary system. It's bimodal, meaning that there's kind of two peaks in the bell curve, but all these other things still exist.
I mean, everybody has the same hormones. They're just different levels of them.
Exactly. Mm-hmm.
Okay. What are some of the mental health risks that are associated with transit? Like, are there risks to transitioning?
So the risks to transitioning come with social consequences mostly. We see some people propping up people who have detransitioned as sort of a model for, see, look what this person went through and now they regret it.
Right.
What we find is that, first of all, any surgery in general has a satisfaction rate of about 86%, right? So there's a regret rate around 14%. That's everything from, facelift to appendectomy to, colonoscopy, et cetera. Gender-affirming surgeries have a regret rate of less than 1%.
I understand that that's depending on the surgery. Male to female bottom surgery will be less than 1%, but my understanding is female to male bottom surgery has a much higher percentage.
Okay, so we're talking again population-wise. So yes, it's going to vary from procedure to procedure, and phalloplasties have not gotten great over the years.
Okay.
But for some reason, vaginoplasties are really good. We're really good at making pussies. Don't know why. Could be a patriarchal societal thing.
Patriarchal. I'm sorry.
But
Oh my goodness, make the kitty cat purr.
But people are still, when they have that severe genital dysphoria and they have that procedure, most of the time they're satisfied with the results. And to the myth of desisters or detransitioners, there was one study that came out that was totally debunked. And in fact, you can watch Drew McCoy on Genetically Modified Skeptic on YouTube break down the myth of the 80% detransition rate. It's way out there. No, it's less than 1% of people who detransition. And of those people who detransition, their reasons for detransitioning are social. They couldn't get along in their job. Their family rejected them. Religion, etc. And of those who detransition for those reasons, when they change their situation, when they get into a more affirming space, they retransition back. So
That is interesting.
there may be a handful of people out there who go through transition and are like, man, this wasn't right for me. That's a very low number.
Right. Fair enough.
And part of that is because we have all these safeguards in place. The World Professional Association for Transgender Health Standards are, by law, what I have to follow in the state of Washington, in addition to the little extra things that the state of Washington puts on it.
Right. Okay. Are you finding that there's differences in I don't know, the experience of being transgender across different racial or cultural backgrounds?
Certainly. Anytime our identities intersect, we're going to have to deal with what one identity brings up for us, what the other identity brings up for us, and what they bring up together, right? So if I'm a black trans woman, I'm having a different experience than a white trans dude.
Okay. Makes sense.
Yeah.
That actually makes a lot of sense. That makes a lot of sense. Got one more question here for you that I can think of. What's one thing that you wish more people, maybe even providers, understood about trans people?
Oh, that the experience that they're having is real and valid. We have studies that back up the validity of those experiences. So they're brain scan studies, neurobiology. Richard Sapolsky does a great talk on the neurobiology of transgender people. That what's going on is an actual thing. And it's not just something we're all making up and pretending about, or as Richard Dawkins would say, delusional about.
I mean, aren't the studies produced by companies that are trying to get a specific result?
Yeah, we got to trans all the kids, right? No. Serious about this. It was a Danish study just followed, I think, 10,000. It was a big sample size of trans youth for about 20 years. I can't remember exactly what it was they were looking at, but again, their results consistent with the lived experience that people are telling us.
I really like that.
Mm-hmm.
Okay, you weren't prepared for this. I brought a game, if you're down for a game.
Sure.
Okay. I call this game Shrink This.
All right.
So the way it's going to play is I'm going to present a situation, and we want you to shrink it down to one sentence. For example, all emojis are replaced with pictures of turnips, Maybe the result can be sometimes life swipes your smiley faces for turnips, but the key is still learning to send the message.
You lost me. Do you have a different example?
Sure. A person's convinced that their toaster is secretly judging them. So the response could be like, it's not about the toaster, it's about what you're projecting onto the toast.
I got you. Okay. All right.
So here we go. We're going to have some fun with it. You look so lost, Bear.
I just put butter on my toast. I don't know. I don't.
You can, by the way, if you're interested, you can purchase a toaster that will reliably produce an image of Jesus on your toast every time.
Oh, no, I've seen one that does Darth Vader. You can get Darth Vader to show up.
Maybe, I wonder if they do a Carl Sagan one.
I love you. That's amazing. All right, so here we go. Shrink this. Humanity suddenly remembers every awkward thing they've ever said all at once.
Mass extinction due to embarrassment.
Mass extinction. Fair. Mm-hmm. That would be a heavy weight to carry on it. Mm-hmm. The moon applies for political asylum on Mars.
Even our closest celestial neighbor thinks Earth is crazy.
Yes. That's like that video, man. Mars saying F this.
Yeah.
Oh, my goodness. All right. Cats develop the ability to speak, but only in sarcasm.
Situation normal.
All coffee is replaced with lukewarm broccoli water.
The cruciferous vegetable lobby has won.
That's so good. Okay, a couple more here. Gravity is temporarily suspended, but only in your apartment.
You want to come up in my place?
You're so quick at this. Every song in the world is now Baby Shark, but different tempos.
This is my life. I have a 4-year-old autistic son.
Oh my goodness. All mirrors are replaced with pictures of Nicolas Cage.
Wow, you look good today.
I can't with this guy.
It's fantastic.
Okay, last one. Dogs can suddenly read your mind.
My dog started walking the priest next door.
You're so good at these. And so quick. It was so fun.
Oh my God. Okay. Geof, thank you so much for coming on the podcast. Is there any way that people, any shout outs or anything like that? You had mentioned earlier there's like, but before we started the podcast, there's YouTube channels, stuff like that.
Well, I have a couple of YouTube channels. There's zero content on them right now, but that'll be coming. You can follow my public-facing Facebook page. It's Geof Richie, MS LMHC, and that's Geof, Geof with one F, RICHIE. MS LMHC.
ABCD.
ABCD, LGBT. The clinic where I work and where we specialize in affirming care is called Wild Heart Society. You can visit wildheartsociety.org. And for parents of trans kids, there's a link on there to the Camp Wild Heart podcast by Mackenzie Dunham, and great resources and information for you there.
Wonderful. Thank you so much. You got anything else, Bear?
No, I just wanted to thank you again, Geof. Like, this was that was a lot of information, a lot of great, solid information, and I personally thank you for joining us today and sharing your experience and all of your insight. That I just just want to thank you.
Well, thank you. And any excuse to get down to Portland.
Oh, sure.
Keeping it weird down here.
Mm-hmm. That's right.
Thank you again. Anybody listening, feel free to go follow us. We're on all of the socials. Make sure to spread the word. We have been growing, actually, really well over the past week. I think we had 300 new subscribers. We went from 69 to 369. So make sure to follow us, share everything. This is important work we're doing. I've received amazing messages from people. I had one the other day. Someone wrote me and just said, "Hey, oh my God, you guys have given me a reason to live again." So
that's good stuff.
It's really good stuff. It's important work. So please share everything that it helps us. It means a lot to us. It's a personal thing for us. So thank you again for listening to the Transplaining Podcast, episode number 3. And y'all have a wonderful day. Welcome to the family.